Hey guys, Woodruff here. So now let's go into arterial versus venous, and specifically arterial versus venous ulcers. So this is another, Nurse Mike video that I like that talks about PAD versus PVD and really highlights some of the differences. I find it super helpful. Let's see. But this is an illustration that kind of helps break it down. We've already talked about some of this, but when we just talked about arterial, and by the way, this is a part of my long lecture over vascular disorders. We just went over PAD, so now we're moving into the difference between arterial versus venous issues. So there's a couple little rhyming things here that might help you, but really it's looking at what's the issue or what's the problem here when you're looking at arterial problems versus venous problems, because this helps make a lot more sense why the ulcers look the way that they do. So keep in mind with arterial disease, we have a problem where there's ischemia or a lack of blood flow, and dead tissue can result, because if there's no oxygen, wounds can't heal, tissue cannot get any better, and tissue just starts to die off. Where when we have a venous problem, and we haven't talked about venous issues, this is a different type of problem. There is no problem getting blood flow to the feet. The issue is getting blood flow back from the feet, from all the beautiful capillaries in the feet. Everything's getting exchanged there. But now what's going on is the blood is trying to get pumped back through the veins. This is a vein problem. It can't get back to the heart. And why would it have a problem with that? You have to think about is that in the veins, there's what are called valves, and they kind of look like this, and they open and close as blood is coming through. But sometimes you can have leaky or incompetent valves or other issues, or people that have different venous issues, which we'll talk about, like maybe obesity, other things can put pressure and make it harder for them to work. But there's an issue getting flow up. So people with venous problems look very different than arterial because their problem is different. They actually have almost like leg heart failure, where their blood is backing up or cannot get returned to the heart as easily, or they're starting to have these incompetent valves and other things that are leading to this backflow. So as you can see in this picture, and this is not my picture, all credit to that person who made it. It's beautiful. What you want to think about is that with arterial problems, we talked about it, like there's no swelling, but there's also no pulse, there's cat sneezing like crazy. Excuse you. So we have to. Oh, hold on 1 second. Let me pause this. I don't know what's going on with her sneezing. Sorry about that. I don't know what that sneeze attack was, but it was rather distracting. Maybe she was trying to steal the spotlight. But wouldn't it be cool to have like me talking, but then have her face here? I'm not like a crazy cat person or a huge cat person or anything like that. But, I love all animals. But I think it would be interesting, and it would be a way where you don't have to see my face. That'd be even better. But I know y'all probably prefer to see me, and she can't do the hand motions and other things when I'm trying to do things, I guess. For now, you're stuck with seeing me. So anyway, getting back into it. Let me back up a little bit. So arterial issues, we have these, shiny, really taut or tight skin, hairless legs, no pulse. With venous, it's the opposite, where they have these really swollen, edematous legs. And there is a pulse, because this is not a perfusion problem. This is a backflow problem. So there's nothing going on there's plenty of blood flow going to the feet, no issues there. They also have kind of a brownish tinge a lot of times to the legs. The pain is also different too, where in arterial, it's like a sharp, sudden pain, whereas with venous, it's more of a dull or achy pain or a heaviness that they might complain about. There's also going to be differences in their source, but we're going to get to it. I actually have an activity, let's see if I can get to it, to kind of bring some of these over to separate the difference between arterial and venous. So let's see which of these apply. Let's see if we can get through this. So the first one is that the eggs, oh my God, eggs. I was trying to say elevate and legs at the same time. Let's try this again. Maybe either that or I'm hungry. But I think I was meant to saying elevate and legs together, but not eggs. I'm glad I can make myself laugh. So elevate the legs to relieve symptoms. So in arterial or venous, do I want elevated legs? So I always remember arterial, remember you want the legs dangled. Venous, or V, see the V here, we want the legs elevated. So this elevating the legs to relieve symptoms is going to apply to V, venous. The next one is has weak or no pulse. So if you remember, weak or no pulse, this is the one where there's a flow to the feet issue. So that's going to be A for arterial. They have a flow to the feet issue. So therefore, they're going to have a weak or no pulse, whereas my venous counterpart is going to have a much better or regular pulse. Ulcers usually show up at the bottom of the feet or the toes. So this you have to think about where the problem is. So the problem in arterial is they're getting no flow to the toes. If they're going to have more ulcers around that area, that would make sense. So if I have a loss of flow issue to my feet, that's where I'm going to start to have the actual ulcers. That's where the problem is. Whereas with venous, they're having more of a fluid collection. They have no problems getting flow to their toes. What they're having a problem with is, getting that fluid back. So they end up having fluid accumulation around their ankles and their calves, which is more likely where they're going to have their ulcers. So ulcers around the bottom of the feet or toes is A for arterial. Intermittent claudication is common. Hopefully you remember with PAD or arterial disorders that or other arterial disorders, but we're talking about PAD here, that it's going to be common for arterial. So we got another A. Compression helps to improve symptoms. So you have to think about if I have a flow issue, if I have a problem getting flow down, is squeezing it going to make it better? I'm not trying to get flow back up. Compression helps to get flow back to the heart, but it actually makes it worse. Think of it like if you had a garden hose and you put like a rope or something really tight and started to squeeze it, it's going to make that flow even worse. And so compression is not good for arterial. It is good for venous. And I'm not just throwing gang signs or anything like that. I am showing B for venous, just in case you're wondering. The skin is warm to touch. So remember with arterial, they have a poor flow issue and they're usually more pale and cool. So remember that word pallor, and then they have the poikilothermia of being cold, if you want to just throw in some of those fun catchphrases. For venous, they are going to have the opposite. Remember, venous is not a flow to the toes issue. Venous is an issue getting blood backwards. So they have like all this blood pooling in their legs. If they have blood pooling in their legs, how is it going to feel? It's going to feel warm. So this is V for venous. Then sequential compression devices help to prevent this. So this is another thing. Sequential compression devices, again, that compression, which one wants compression? We want compression in V for venous. Skin is pale. So again, we're talking about this. The pale or the pallor is when there's less blood flow. I have less color to my skin when there is less flow going to it, because red blood cells are actually a lot of what bring color to they bring color, especially someone with paler skin like mine. They bring the color to it. And so when it says skin is pale, which one are we talking about? We're talking about someone with a arterial problem. They are going to have less flow to their feet, and therefore usually they're going to have that elevation pallor and going to have a lot of issues with the color to their extremities. The next one, movement should be encouraged to prevent this. So just like compression, movement helps to provide kind of a pump or a squeeze, because when I walk around, what I actually have in my like calf muscles and stuff is, and it's a natural, it squeezes the veins and helps, especially in those valves, to get blood pumping back to my heart in my veins. So in order to actually prevent a problem, what's going to help is movement's going to help for, let's see which way. Oh, I'm losing my mind. V for venous. So yes. Now you might be looking here and saying, hey, movement. I think you said movement was good for PAD. Movement is good for PAD, but you can't move. You can't prevent PAD by moving alone. Now with venous issues, a lot of it's going to be the compression, the movement, and the elevation. When we talk about venous stuff later, arterial is all about the dangle. Venous is all about movement, elevation, and compression. Skin is cool to touch. So if I have a patient whose skin is warm to touch, we talked about the pooling of the blood for venous disorders, but if their skin is cool to touch, this means they have low flow or no flow. So I am dealing with a low flow to the feet issue, which is a arterial problem. Ankles or calves are browned. So this kind of goes back to what I was saying in the last thing, where you end up with these, we're talking about a venous issue. So with these patients, they have a accumulation of fluid in their ankle or calf areas, and this leads to a brownish discoloration. And that brownish discoloration, is just it's usually a result of the pooling and the stretching and the edema as a whole. But remember, when we talk about arterial, there's usually more of a pale color, loss of hair, that stuff where, with the venous patient, they have these really thick skin, and then because good flow. But the issue is there's just this pooling of blood in the legs. Ulcers usually show up around the ankles or the calves. And so this kind of goes along with our last one. If I'm having an ankle calf problem, I'm usually having a venous issue. So yes, because I'm having an issue where blood is pooling and accumulating. This is where they get their ulcers. The skin gets really thick, but they end up a lot of times needing like skin grafts. Their skin can get really broken down. It gets really weepy and oozy because there's good blood flow. There's lots of fluid there. It's accumulated. Last but not least, vasodilators can help to relieve symptoms. If I gave a patient with a venous issue a vasodilator, what would happen? Vasodilators cause pooling. They open and allow for better blood flow. This might seem like a good thing. You might think, oh yeah, venous, like let's get them open and flowing back to the heart. But you got to remember what the problem is in venous. The problem in venous isn't that there's closed or clamped down blood vessels. The problems in venous is that there's an incompetent valve where that valve's not opening. There's not enough compression. There's not enough muscle pump to get the blood back to my heart. If I actually vasodilate, I'll make it even worse. So the only one this would be appropriate for is arterial, and that's because I have a constricted vessel issue. And remember, this is where they have that intermittent claudication. They have that kind of screaming ischemic pain. What's going to help with that pain is going to relieve the ischemia or relieve the blockage and open up those blood vessels. So we're talking about arterial here. Hopefully this helped. So what's different about arterial and venous disorders and their ulcers? So if you want to break it down, this is a great thing to do, is to make it more simple, is to separate it or even do like a side-by-side table. You want to think about location-wise when it comes to ulcers, is that usually for arterial, they're going to be on the toes or the feet, again, because that's where the lack of flow is. So tissue and cells start to die there. If they get, you can also easily get injury to those places. And if they can't feel it, they don't know it's there. Whereas venous, it's more of the ankles. The borders for ulcers for arterial are going to be more round and smooth. Whereas for venous, they're usually going to be irregular and they might even be larger. Drainage wise, remember for arterial, they're going to have minimal drainage. There's no flow. There's not a lot that's left that can drain off. Whereas with venous, they can have, they have moderate to large amounts of drainage because there is more flow, there's more moisture. There's all this pooling of blood. So there's a lot of time, or pooling of blood and fluids and stuff shifting and stuff like that. So there's usually more weeping and drainage. And then for arterial, there is dead tissue. It's that S-jar, however you say that, that blackened tissue. Where for venous, there's no dead tissue usually. It's just going to, there's good blood flow, there's pulses, but the issue is that there's, sometimes what's called yellow slough, or kind of like this buildup of this yellowish tissue, as you can kind of see here. This is what slough looks like. So ulcer treatment is going to involve For arterial is going to be doing things that help with arterial problems. So remember, what do we do for arterial problems? We dangle or dependent or put them down. We want to think there's going to be more infection issues because there's lack of oxygen. Lack of oxygen means, cell tissue death. So they may need things like antibiotics more likely than if a patient had a venous ulcer. They're not going to be as high needing a high likelihood of needing antibiotics. They may also need an amputation. They're more likely to have to get to lose their limb as a result. We want to teach the diabetic foot care. Ooh, here's another place where I have a little typo. Also treatment. I need a full parentheses. Okay. I'm going to put diabetic foot care. Diabetic. All right. So anyway, so I said I was going to talk about this in my last video about reminders about diabetic foot care. So just remember some of the big things from diabetes. I don't know about if you don't go to my school, you go somewhere else, they might be different, but us professors love to cumulatively bring stuff. So we've already talked about diabetes. So it is very possible you could see something from diabetes on this exam. So you want to remember your diabetic foot care because diabetic and cardiac go together hand in hand. So diabetic foot care, some of the big things, I'm not going to list them all, but definitely some things to remember. Don't go barefoot, moisturize, but not between the toes. Check your feet daily. If you can't see, have someone else check your feet. You always want to make sure to wear well-fitted shoes, dry the feet and stuff well, avoid temperature extremes, cut your nails straight across, or preferably have like a podiatrist do them. And I could go on, but these are just a few of them. But definitely want to review those and just know that these are harder to heal because of the lack of oxygen. You need oxygen to be able to deliver all of those healing and helpful new particles and tissues and things like that. Venous ulcers, on the other hand, remember A for arterial, V for venous. I'm going to elevate. So remember the three things that help are elevation, movement, and compression when it comes to venous. Know that, like I mentioned earlier, a lot of times they need skin grafts, or they just end up with, because it's so moist and it's like just like macerated and like really, like because of all the fluid shifts, has all that drainage, they can end up needing like skin grafts and having really bad breakdown of their tissue. They might not need antibiotics as often, but they can definitely have more like tissue problems, not death, but it's just like that. I'm trying to think of a way to describe it, but effectively, especially the surface layer of the tissue just gets very destructed. It's very hard for it to, especially with the irregular borders and everything that they have with it, it's just very moist and wet, and it leads for it to not be stable, or I keep wanting to say like not heal well, but it's not necessarily, it's not healing well, but it's not about the oxygen, lack of oxygen. Because remember, venous, there's oxygen, but it's harder for the skin to repair itself completely because of all the moisture and swelling. Oh, that's it. Anyway, that's it. Until the next one, we're going to get into blood clots. I know you can't wait. More cardiac coming your way.